In this video, we're going to talk about one of the subjects that I'm most passionate about, which is hormones, and also tackle one of the conversations that I think needs to be had a lot more, which is the effects of birth control on our bodies. Did you know that over 100 million women worldwide are on birth control? Many of them get on this without really even questioning the effects or really understanding how it works. The doctors that prescribe it a lot of times don't even sit down and talk about side effects or even themselves understand really the overall effects that it has. Birth control pills are commonly prescribed just to control symptoms, to stop things like acne and mood swings and irregular periods. But did you know that the negative effects that oral birth control can have on the body and brain are plentiful, and there's research behind it, and we'll tackle all of that in this video. One of the biggest aspects of birth control that I think is worth discussing is that the way that oral birth control works is by shutting down the communication of the brain to the body, especially to the reproductive hormones. Each cycle for a woman should really be this intricate fluctuation of hormones that signal the ovaries and brain to release certain hormones depending on what time it is in the month. Research shows that oral birth control changes the brain and interferes with the way that the brain communicates with the ovarian hormones like estrogen and progesterone and testosterone. This is also why we see many women having problems conceiving after coming off birth control, especially if they've been on it for years and years, which we see now some women, have been on it for 10, 15, even 20 years. And then, they really spend the first year to possibly 2 years having difficulty conceiving as the brain and body sort of get reconnected. This is just a simple concept that I think a lot of times just isn't even addressed when the pros and cons of birth control are discussed. The other thing about oral contraceptions that we do know is that they deplete many nutrients. Some of the nutrients are like B vitamins, selenium, and zinc, and these are really essential for overall health. So I think it's important to sort of us to take some time and let's look at the 4 major nutrients that are depleted. So first, B vitamins. Birth control does reduce the levels of B vitamins, including B2, which is riboflavin, B6, and B12. And these vitamins are important for energy production, mood regulation, and brain function. So we do need these B vitamins. So if you're on birth control, please make sure that you are at least supplementing, B vitamins. And also the next one, magnesium. Magnesium is so important in the body. We use it for over 300 different chemical reactions and processes in our body every day. And birth control pills can decrease these levels of magnesium in our body. And this is just such an essential mineral, and it plays such a role in muscle, nerve function, blood sugar regulation, bone health, mood regulation, sleep. And so it's really important to realize if you're on birth control that your magnesium levels are probably lower. Zinc is another one that is depleted with birth control, and it is important for immune function, wound healing, fertility. And so zinc is really an important one to make sure that you're getting in good levels if you are on birth control. And then there's also selenium, and birth control pills can reduce the levels of selenium in a woman's body. And this is a major antioxidant, and this and some other antioxidants are depleted with birth control. And these antioxidants are needed to decrease inflammation and oxidative stress. So women on birth control then do tend to have a smaller level of inflammation and stress at the cellular level just from being on birth control. Selenium is also really important in thyroid function. So we'll talk about that a little bit later in this video about how selenium being depleted is one of the ways that thyroid function can be affected when on birth control. So now if we look at some research and some other things, there's other interesting parts of health that I just don't think are talked about enough as things that are changed and altered by being on birth control. So another interesting aspect is that it can disrupt the microbiome. And what the microbiome is, it's that collection of bacteria and other microorganisms that live in our body. And we talk a lot about in the gut, but it also lives on our skin. It lives obviously in our gut. It lives in our reproductive organs in our vaginal canal. So it's really important for us to have this microbiome that makes us up completely to be intact. And we do know that the microbiome can be affected. And this can lead to a lot of issues, including digestive issues, and inflammation when this is altered, that microbiome is altered. So looking at some studies to really put this into perspective, a study published in the Journal of Scientific Reports found that women who used oral contraceptives had significant differences in the composition of their gut microbiome compared to those who didn't use them. And this study also found that birth control was also associated with lower levels of beneficial bacteria, such as lactobacillus, which is such a major one for our body. And this good bacteria is vital for not only overall health and gut health, but that vaginal microbiome. And lower levels of this can lead to not only an increased risk of infections, but other reproductive health issues because our bodies are dependent on this for function. And other studies have even shown that birth control might even be a contributing factor for some of the antibiotic resistant strains that we're seeing. And so there are a lot of changes to the microbiome from birth control. Also, birth control can interfere with thyroid and testosterone levels, which we touched on a little bit, but to get into this a little bit more in depth, when we alter our thyroid and testosterone levels, we lose a lot of our vitality. And this can really impact mood, energy levels, and sex drive. And some studies have also found that it changes who we are attracted to, potentially impacting our relationships. To further sort of highlight this, a study published in the Journal of Psychoneuroendocrinology found that women who used hormonal contraceptives had different preferences when they were looking at features. So when they were looking at sort of the masculine versus feminine faces, they found that women on hormonal contraceptives were actually attracted to a whole different type of more feminine face. And this really, I think, highlights how much of a change this has on our body and our brain, that we actually change some of our primitive features such as just attractiveness and our perception of people. And, furthermore, like if we look at another study from the Archives of Sexual Behavior, it found that hormonal contraception may have an impact on the quality of romantic relationships. And this goes back to what we were just talking about because it changes attraction and mate choice. And so we see that, it not only changes certain things in our body, but it also changes, like I said, some of those primitive brain signals. And so, when we put all this together, that's why I think it's just vital to really have conversations about birth control and to really talk about these kind of things when we also talk about how to balance hormones, because that's such an important part of women's health. So if you're taking birth control or considering it, I think it's really important to sort of take all of this into consideration too. It is more than anything, I think, important to figure out the root cause of hormonal balances. I do feel that many women are just sort of taught that birth control is a way to fix the problem when really it just masks the symptoms many times. And I'm seeing more and more, which just makes me very happy. Women are now sort of being taught to take back the power and to really get in touch with their hormones and the cycle. And I think that this is great and that they should be taught to monitor their cycle to help balance it naturally if they're able to. And honestly, too, there's great tools. Like I love many of the apps, and two of my favorites are Clue and Flow. So Clue is a free app. It allows you to track your menstrual cycle as well as, certain signs and symptoms like pain and emotions and energy levels. And then what happens is that really starts to give you some personalized insights and predictions about your cycle and get you a little bit more in tune to, your cycle and energy, motions, things like that go along with it for you specifically. Another one that a lot of women use is Flow, F-L-O. It's very popular and it allows you to track your menstrual cycle, ovulation, and fertility. It also includes features like Clue does that allow you to track symptoms, mood, and lifestyle factors. And so I know this is a popular one and I really like it. And I can't state enough too that if you are having hormonal issues, it's really important, I think, to assess. And a lot of times Western medicine doesn't assess properly. My favorite, which I talk about in a lot of the videos, is the Dutch Comprehensive Urine Test. This is a dried urine test that really looks at all the different hormones. And so it does test estrogen, progesterone, testosterone, cortisol, and even melatonin and other hormones that play a role with the balancing of our cycles. And one of the main benefits of the Dutch test is that it has the ability to provide really this comprehensive, individualized picture for a person's hormone health and hormone metabolism, the breakdown of the hormones. So unlike traditional blood tests, which only really measure the total level of the hormones that are bound up in the blood, the Dutch test is going to provide you information about how hormones are being metabolized, how they're being excreted and eliminated, and go through different processes in our body that are so important for overall hormone balance. And so this can really help to identify imbalances and abnormalities in women that can contribute to things like fatigue and weight gain, mood swings, and menstrual irregularities. And so if you're having hormone issues, I really recommend that you start there. And if you want to know more, we do have another YouTube video that Dr. Heidi and I did that's all about hormone testing and goes a lot into Dutch. And then the other natural thing that we have, or the natural thing that really would help, is just education on this in general. And at Agora, we have an amazing ebook that was done by myself and our acupuncturist, Andrea, who works so much with hormones and is just really a hormone guru. And we go into detail about hormones and how they're balanced, what plays a role, and then what you can do to really take back the control of your cycle and your hormones, both with functional medicine and oriental medicine. So the great thing about this ebook is it combines the benefits of both, because both can be so good for hormone balance. And so we go into herbs and supplements, lifestyle things you can do, acupressure points to really help balance hormones, decrease symptoms, improve fertility, and empower women to take control of their hormones. So as you can see, I just truly feel that our reproductive hormones as women is one of our superpowers. They really make us strong and powerful. And they also not only make us strong and powerful, but they're also what is calm and nurturing. And so when we really put this all together, they, I think, make us what is so wonderful about the female gender. They connect us with each other and allow us to have everything from intuition and empathy to also strength and willpower. They're great for our mind and body, and they really do need to be balanced. And so many times we do have imbalances and just never fully assess and treat them. And at Agora Health, that's really what we're all about, is empowering women, giving them back control, and educating about what's going on with their body specifically. And that's why, really when we take a comprehensive look at what's going on, and help women to start to listen to their body and understand what it's saying, it really is just incredibly a different ballgame. And I think one that more people need to not only consider, but be able to have the conversation about what they need to do. So as always, if you guys do have questions, please reach out to us. We're here to help any way we can. And as always, guys, if you enjoyed this and want to know more about functional medicine and hormones, please press the subscribe button. Like this, subscribe to it. It helps us get this information out to more people. Thanks, guys.